Alhamdulillahi Rabbil Alameen. Walhamdulillahi Rabbil Alameen.
Supreme Council for Islamic Affairs. National Supreme Council for Islamic Affairs, after the remarks, it will also lead the interactive session, inshallah.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم وصلى الله على النبي الكريم. Our most distinguished brothers and sisters in Islam, most distinguished leaders from all over the country, for this very important interactive session. And we give our utmost thanks to our Creator, our Sustainer, Almighty Allah subhanahu wa ta'ala, for His numerous blessings on us and for bringing us from various cities and towns and villages to this beautiful city of Abuja for this very important gathering. You all have a copy of the program, and I was supposed to speak last, but I'm leading the interactive session because after my comments, we'll go into interactive session where all of you are free to say whatever you want to say and ask questions for the experts to give us answers, because the answers are what you are going to take back to your various communities, families, and share with them. And I bet you will still have more questions from them, because this is an issue that the whole world is grappling with. And alhamdulillah, so far, as not expected, we don't have millions of cases in Nigeria. We don't have hundreds of thousands of deaths in Nigeria, contrary to what people thought would happen in Africa. But alhamdulillah, we are here. And I'm one of those that believe that yes, the fact that we have not done a lot of testing, that does not give us the correct figure of cases. And I want to say, if you don't have headache, you don't take Panadol. If you have headache, it will disturb you so much that you must run to a doctor to get treatment for that headache or whatever it is. So since we are not dying in millions, it means something, definitely something positive is with us. And also something negative too is with us. That is the COVID-19. COVID-19 is real. So let's not deceive ourselves that there's no COVID-19, because the millions affected all over the world shows that this COVID-19 is real. And we have to take very stringent, very serious measures to protect ourselves. I would like to also thank all of you who made it to Abuja within very short notice. And I want to thank Dr. Faisal for taking up this issue seriously and decided to host all of us. Some few days ago, there was a Zoom meeting on the same topic, on the same issues, hosted by NAFA. NAFA is a child of NAREC. NAREC is a body formed by Muslim and Christian leaders so many years ago, in which the current president and my humble self are co-chairmen. And we put together this NAREC as an NGO to fight malaria. and we succeeded so far in fighting malaria, and that's been recognized. Now we're in COVID-19, and we feel there's need to sensitize people about COVID-19 and try to bring together Muslim and Christian leaders through NAFA with the Primary Healthcare Agency for the last week's Zoom meeting that took place. So once more, I want to thank the Executive Director for that. Today we're having one of Muslim leaders from all over the country. Tomorrow we're going to have one again, the same topic, with Northern States Traditional Leaders Council on Primary Health Care, in which the senior traditional rulers will be coming here for the same program. Now you have both Christian and Muslim clerics. Now you're having traditional leaders. Such summits, such meetings are not too many, because you must know the issues at hand and how to go about handling such issues. For us as Muslims, we know knowledge is very, very important. And we know Islam was founded on knowledge, because the first word in the Holy Quran, which was given to Prophet Muhammad ﷺ, was Iqra. So we have to continue to seek knowledge all over the world. So these summits, these meetings, these intersections are not too many. And like the ED said, this is just the beginning, because the vaccines are not yet in Nigeria. It's an opportunity for you now to bring up questions to the authorities, your fears on the vaccines and other issues, so that the authorities in the country will now take up such issues, look at them, and provide solutions. We know, yes, there are issues and there are problems. And before I forget, before I go too much into this, I would like just to, at the end of this program, offer prayers to one of us, Justice Abdul Oride, who just passed on, former Secretary General of Jamaat Nasrul Islam and the Sarki Malami of Ilorin, and so many other leaders, so many other clerics who passed on. May Allah subhanahu wa ta'ala forgive them and grant them al-Jannat Firdaus. And I would like to continue to pray to Almighty Allah to give us full health, so that we continue this work of sensitizing Muslims on Islam and what Islam is and what Islam is not at various levels. This program today is so important, and I would like to urge all of you here, because you have heard Professor Oloyede said 1 hour had been given to this internet session. Please feel free to say whatever you want to say. Ask questions, because the experts are here. I've had about 3 presentations, in which unfortunately Professor Mariam is not here, the 4th one.
She now came.
Well, you should have allowed to, since I've spoken now, I'm speaking on her behalf. Because if she had come, she should have given her own talk before we start interactive session. That's what I thought. She was called because she came late. She was feeling somehow. But we'll give you the chance to speak. If you are given 5 minutes before, we'll cut it down to 2.5 minutes. So as a professor, you have to know what to tell us in 2.5 minutes. Like Professor Oloyede did. I was so surprised. He had about 5-page paper and he spoke for about 3 minutes. I think because he's now in JAMB, that's why. He's learned to write answers to questions in a such straightforward way that the exam marker will just say, yes, you have passed, you know what you're talking about. So please feel free. There's no question that is stupid. None. But from the past 3 presentations, including the comments of the ED, I've not had any semblance of an answer from any of the speakers On this very vexed question of why was the vaccine gotten so early, within 1 year, and other vaccines for either cancer and other killer diseases have not been gotten, have not been produced? Because these are questions people keep on asking us. I don't have an answer. I'm bringing that one here. Then maybe the experts will be able to tell us, so that when we go back to our people, we'll be able to tell them, to give them answers. These are what the experts say. Because what we take away from this entire session, is so important. It will help us to convince people of the need to take vaccine or not. I believe that we cannot force people to take vaccine. Because I give an example of polio. When Almighty Allah brought me to this position in 2006, we had very serious cases of polio in Nigeria. The then Minister of Health, Professor Oshotimehi, approached me that he wants us to use traditional leaders to sensitize people. And I said, okay, no problem, it's our job. We want to see healthy communities. And that's how we now picked a senior traditional ruler from each of the 19 northern states and FCT, making 20. And we set up that committee on Northern Traditional Leaders Committee on polio. When we started after 2, 3, 4 years, we changed the name to primary health care because we now went into everything health. It is the work of that committee that was able to give us that certification of polio-free country after almost 12, 13 years. Now that's the importance of leaders, traditional leaders. And traditional leaders cannot do anything without the religious leaders. And I have always said it that any traditional leader who is not seen, who is not close to a religious leader, is not a good traditional leader. And that's why you always see me reaching out to these, our malams, our leaders, to tell us what to do and how to do things. And that's very important. And that's what gave us that victory to overcome polio after decades and decades of that very terrible illness that crippled our children and never to get back their lives again. So this is an opportunity now for you, because I know Professor Ishaq Akintola of Murik will have 101 questions. But he will be given only one chance to ask one question, because I am going to moderate this entire session, so that when you speak too much, I will stop you. And when I stop you, you must stop. I have seen the Secretary General of Muswen. He's hiding behind. He's supposed to be in front. As important as Muswen is, we know definitely you have things to say, you have things to contribute. But the bottom line is the importance of this gathering. We have Muslim leaders, imams and whatever from all over the country for this very important session. So it's a positive thing for the Primary Health Care Agency to bring us together, and tomorrow also bring the traditional leaders together, so that we'll discuss all these things. You have a lot of myths about COVID-19 and the vaccine. If you check your program, there are 2 pages there where questions were provided and then answers given. And I expect all of you to have read through, and then maybe from the answers also ask more questions, because you see, the more you ask questions, the more knowledgeable you become. In the military, we're always taught to say, if you get this, then you say why. You get an answer, you say why. Get an answer, say why. Continue saying why and why and why, until you find that you have nothing more to say. So the myth is there. People talk of conspiracy theories. The vaccine is meant to kill us. There are so many videos circulating, very negative videos. Now ask questions on that. But my own take, and I'm not giving answers to anything, if the vaccine is meant to kill us, will anybody wait for this vaccine, COVID vaccine, before killing us? We have been taking Coca-Cola for centuries. Coca-Cola, Pepsi, even Panadol. that is imported into the country before EMZO decided to have this, its paracetamol and things like that. So many drugs are imported from outside into Nigeria. Now, if anybody wants to kill us, there are 1,000,001 ways to kill us. But I'm not giving an answer to anything that the COVID vaccine or whatever is this. No, I don't have an answer. And that's why you are here. That's why it's a free atmosphere to discuss and say whatever your mind is. Say your mind, don't hold it. Don't think that, oh, because I said this, so the answer, I don't have an answer. I'm just leading this intercession so that you now know areas where you are going to ask questions in which the experts here will be able to tell us what to do. I know in the past, I think 2016 or 2015 or 2014, we went to Abu Dhabi for the World Vaccine Summit. And we're talking of this polio. And the world's richest people came to Abu Dhabi to help the underdeveloped countries get these free vaccines for illnesses. That was 2014, I think, about something like that. And I went with so many Muslim clerics from Izala, Tariqa, I don't know who went with us from the Tijaniya, you know, and I know that I went with Balalau and Sheikh Zakaria and so on. And we were looking for $5 billion to procure vaccines, to produce vaccines. And there on the spot, we got $5.5 billion. Because people kept on asking, why are they giving us polio vaccine free? Not knowing that people have already paid for the vaccines outside, and it's just being brought to us, and we're giving the... So I'm just giving these examples of, if vaccines come, and you are to be given vaccines, who provided the vaccines? The vaccines are free. You are not going to pay for the vaccines. But to take the vaccine is your own choice. How is it your choice? You have to find out the truth about the vaccines yourself. How do you find out the truth? Knowledge, communication. How do you get that? You have experts here who gave us talks, including the executive director here. So there are so many rooms to talk about all these issues. So let's be very free, discuss whatever we want to discuss, and then at the end of today's program, you'll tell us what to do. If you still feel that, look, let's go and continue our discussion and then come back after certain hours or days or weeks or whatever before the vaccines arrive, so be it. But ask questions. When these vaccines also come, how is the storage capacity or storage facilities of our government? Because if these vaccines are not stored in a particular environment and temperature and whatever, they become useless. So you end up taking vaccine that is useless. So check your, like I said, check your program. There are questions there and there are answers. But I want to urge all of us as Muslims, be very open-minded. Ask questions, because our health is very important. Because it's only when you are healthy that you can even worship Almighty Allah subhanahu wa ta'ala, who created you to worship Him. So if you feel that you don't want to take it, ensure that you don't give disease to anybody. Supreme Council had done its own. The private healthcare is doing its own because it's a job and will continue to do so. So we have to, and we must find a common ground how to intimate or pass this information, pass this education to our followers. Yes, this is good, this is bad. But before you say something is bad, you have to know that it's bad. Before you say something is good, you have to know that yes, something is good. So whether it will kill you or not, by the time your time comes, whether you take vaccine or not, whether COVID or not, you must go. So I want to assure you, we'll continue doing our best so that we have a healthy society. So that's when we'll have a healthy country. And I want to thank all of you, especially I heard the professor here saying that he was given very short notice. We want to thank you and all others who are given short notices to come, and you came, because you know the importance of this. So we want to the professor, you know, is Professor Jamba. He had just ordered me that I have to give the lady the time And she's not a lady, she's a professor like him. So you're on the same level. Professor. And I've said, maybe you didn't hear well when I said that we'll give her 2.5 minutes before. You didn't hear that one. Maybe you were sleeping. So, like I said, I will moderate the conversations. Feel free. Let's get to the root of this. Let it be the first, maybe we are coming together, and we'll continue to meet and discuss. I would like to thank all of you for coming. And I request Professor Mariam to come and take her, is it 1 minute also? Because you said you need only 1 minute. Because it's reducing. Okay, so thank you very much. Wassalamu alaikum wa rahmatullahi wa barakatuh.
For us at the Federal Ministry of Health and the National Primary Healthcare Development Agency, today is an auspicious day for us. It is very instrumental that not too long ago, many Islamic scholars present here celebrated the feat of eradicating white polio virus from Nigeria. That feat will never have been possible without the sterling leadership of the Sultan of Sokoto and many of the Islamic scholars and imams here. Today, we're gathered to talk about the COVID-19 vaccine, largely because we have learned from our lessons. What are the lessons that we've learned? Early on in the polio eradication program, we did not seek the buy-in of religious leaders. We did not seek enough the buy-in of traditional leaders. We cannot make the same mistakes twice. This is why, even before the COVID-19 vaccines have arrived in Nigeria, we are engaging and sensitizing our religious leaders so that when they have the buy-in, when they understand the expanse of COVID-19, then they will be able to communicate with their followers in a language that only they can. Religious leaders, as we are well aware, are very respected in their communities. And it is whatever they say that the believers and the followers take home to their families and their loved ones. So for us, we cannot overemphasize how the collaboration that exists between the National Primary Healthcare Development Agency and the Supreme Council for Islamic Affairs is very, very critical. I want to take particular care to appreciate the leadership of the Secretary General of the Supreme Council for how within a very short time he was able to organize this meeting today. Thank you very much, Mr. SG. Distinguished scholars, distinguished religious leaders, we hope that today will not be the last opportunity for us to listen to you, to learn from you how we can do a better job of communicating with Nigerians. Today, we as government, we as the Federal Ministry of Health and the National Primary Healthcare Development Agency, we'll be listening to you. We'll be listening to how we can deliver vaccines effectively. One thing that we have learned is that it is not enough for government, scientists, public health experts to offer vaccines to citizens. We also have to do the hard work of making sure that we communicate effectively how these vaccines work and why people should take it. This is why, as part of the collaboration that we're having, we also want to listen. We will not dismiss the concerns of Nigerians. Instead, we will understand what those concerns are and help them get a better understanding of how vaccines work, I want to assure you, as I wrap up my welcome remarks, that no vaccines will be brought to Nigeria unless they have been certified safe and effective for use. We're working with NAFDAC, which is the regulatory agency that will certify these vaccines as safe. We would rather have no vaccines in Nigeria than to bring a bad vaccine to Nigeria. This is why we're working with you, and we're hopeful that in the course of all of the processes that are required, from when we receive the vaccines to when they are delivered to our communities, that the Supreme Council is with us, just as we have our Christian brothers also with us in all conversations around the vaccines. We are particularly appreciative of the Sultan for taking out time to make sure that this meeting holds. I know several weeks ago when he started pointing out all of the stakeholders' engagements that were necessary, this was the first one that he mentioned. And for him to be here personally is only an indication of his commitment and how important he feels this body is towards being part of the conversations around COVID-19 vaccines. So thank you very much, Your Eminence. Thank you very much, distinguished scholars. Thank you very much, members of the press. Thank God and God bless.
Takbir. MashaAllah. And the next on the program is setting the agenda by Professor Ishaq Oloride.
Representative of the Honorable Minister, ED, the Deputy President General of the Nigerian Supreme Council for Islamic Affairs, South, Your Highnesses, distinguished ladies and gentlemen. Let me, on behalf of His Eminence, quickly perform the role of setting the agenda. This had been distributed because we are aware of time, and I believe that we will go through. When a couple of days ago, His Eminence re-emphasized the fact that there is the need for the Muslims, particularly Muslim scholars, who are influential, to be sensitized on this COVID-19 vaccine. His Eminence directed that this is very, very imperative to be done, particularly in view of so many misinformation going on, particularly at the social media level, where people are misinforming people, campaigning against the vaccine. Consequently, he directed that the Muslim community should be sensitized, and that's why we are here. We are particularly grateful to the Executive Director of the Nigerian Primary Healthcare Development Agency for this collaboration. We are aware that the raging war against COVID-19 is global, and at the Nigerian level, we will see that the situation is not radically different from what goes on elsewhere. Alhamdulillah, in the midst of all this, we also know that it's Almighty Allah who heals eventually. But it's Almighty Allah has also advised us on taking good care of ourselves. And that is why it is said that when I'm ill, it is He who heals me. And that is in Quran chapter 26, verse 80. It is hope that as government will be bringing in the vaccine, the Muslim community, particularly through the member, will communicate with the Muslim community so that the community will be well sensitized. Today's meeting is an avenue for not only for the government through the National Primary Healthcare Development Agency to tell us what government is doing about the vaccine and what government is expecting us, the Muslim community, to do, but also to listen to you, because you are coming from the community, And that is why when you look at the program, a whole hour, 1 hour had been dedicated to listening to you. So it is important that we listen, but at the same time communicate our position so that at the end of the day, we will be able to take steps that will be beneficial to the community. Today, we have drawn these participants from the Muslim community across the country. Membership of this consists of traditional rulers, 75 eminent imams and scholars here, 40 other medical experts, and about 50 other persons who have already joined us on the Zoom. They are participating through Zoom. We also welcome them too. The overriding purpose of this gathering is to undergo a training of the trainer, TTT interactive session, because you cannot give what you do not have. And that is why it is important that after interacting with you, it is expected that you then be able to interact with the others. Participants are expected to pose frequently asked questions and all questions you might have gathered from others, which agitate the minds of the people for clarification by the medical experts. We also believe that at the end of the day, the Nigerian Supreme Council for Islamic Affairs, on your behalf, would then tell us what are the plans, what are the strategies for communicating the Muslim community at the state and local government levels. At this juncture, once again, let me put on record that we will not have easily pulled off this meeting at short notice without the leadership and unconditional goodwill of His Eminence the Sultan of Sokoto and President General Nigerian Supreme Council for Islamic Affairs. He is very, very passionate, very, very passionate about it. Just as he has recorded a very large success on the other vaccine, what do we call that one? The polio vaccine campaign. He will also make a success of this one. We must also thank the Executive Director, Dr. Faisal Shuaib, and the entire staff of his agency. I must also thank the Task Force on Desensitization, headed by Dr. Nasir Guazo, who is joining us by the Permanent Secretary, Federal Ministry of Environment, who is joining us by Zoom. We also, and all members of the committee who work very, very hard to make this possible. Your Eminence, distinguished ladies and gentlemen, let me urge us as Muslims to open our minds, listen carefully, and ask questions that will be beneficial to the community. Subhana rabbika rabbil izzati amma yasifun wassalamu ala al-mursalin walhamdulillahi rabbil alamin. Sallu ala nabiyyika.
For us scientists, we work a lot about the causative agents, the virus. Viruses are very simple structures by nature, but many of them can cause diseases. And they have certain peculiar characteristics that make them very interesting. Viruses easily change. We say they mutate, or we say they undergo antigenic shift, antigenic drift. For the purpose of this audience, if we could cast our minds back before 2019, there were other coronaviruses that were involved in other outbreaks. This includes the SARS outbreak, which occurred during the 2002 to 2004, and then the Middle East Respiratory Syndrome, which began in 2012. And then today, we have coronavirus disease, COVID-19. Scientists or scientific data, scientific literature has given us a clue that COVID-19 may not going to be the last pandemic. There could be other pandemics. So, as a Muslim world, I think we always need to be ready. The presenter before me has given a small history about COVID-19. The first case, the index case of COVID-19 in Nigeria was confirmed on February 27, 2020. And that was a 44-year-old Italian citizen who came into Nigeria. And thereafter, various government agencies, including the National Primary Healthcare Development Agency, the NCDC, and other agencies, put in place public health emergency operations, which include contact tracing, a number of things. As of today, or to be precise, as of 25th January 2021, the COVID-19 cases stood at 122,996 confirmed cases in Nigeria, with 98,359 cases discharged, and then, unfortunately, 1,507 deaths. On that date, 25th January, 1,430 new cases were confirmed. For us microbiologists and other scientists, this number may appear high to others, but in the actual sense, in the actual dynamics that are taking place at the background, this number may not be a true representation of what is actually happening on the ground. From that, the Presidential Task Force, the Nigerian Center for Disease Control, and all other government agencies are doing well, but there is need to improve on testing capacity. So, largely, the reason that the numbers that we are seeing may be low, may not be the true reflection of what is on the ground, may be our testing capacity. There is no doubt. The fact is that our testing capacity is low. We are testing just some selected groups. Another question we should ask ourselves, are we capturing the situation at the rural areas, particularly those areas that have no television coverages, that have no radios, have no other means of communication, that are almost completely cut off? Now, the second part of the talk is vaccine administration in Nigeria, the challenges from the scientific point of view. This pandemic, the COVID-19 pandemic, is expected to continue to impose burdens of morbidity and mortality while severely disrupting societies and economies. This therefore necessitates the need for the federal government to be ready to ensure large-scale, equitable access and distribution of the COVID-19 vaccine. The previous presenter had presented a strategy which would be adopted in the presentation. Suggestion is that I think that should be looked at the second time. When I heard that there would be something like census, would be visit the wards, visit the local government areas, get data, enroll people, and then begin to provide vaccines, administer vaccines, I think that will take time. If there is any way that can be fast-tracked, I think it will help. The concern about vaccine hesitancy is growing in Nigeria. And in this country, hesitancy and misinformation present substantial obstacles to achieving coverage and community immunity. And therefore, a lot need to be done. Public health officials and advocacy groups must be prepared to address the existing hesitancy and build vaccine literacy so that the vaccine can be widely accepted by the public. Quickly, way forward as suggestions. Use the advocacy groups to build public trust and confidence. As it is now, with all the burdens imposed by COVID-19, if vaccines are made available to the public, I am sure, pretty sure, particularly the rural areas, the acceptability level is very, very low. Vigorous campaign assuring the public about the safety of the COVID-19 vaccine, like the one we are doing here, is important. There should be increased studies to generate data. There should be increased studies to generate data on safety so that the drive to change the public perception should be data-driven. This is to assure the public, establish think tanks for specific areas to quickly identify potential areas of challenges. Now, let me move because I've been warned about time. The Medical and Scientific Committee should play a critical role in information dissemination to assure the public on the safety and efficacy of the vaccine. Lastly, as a suggestion to the National Primary Healthcare Development Agency, we should begin to be specific about the type and kind of vaccine we are going to introduce. Just 1 minute, please. We are going to introduce. There are different types of vaccines from the scientific point of view. We have those vaccines that contain the organisms that is either killed, inactivated. We have those vaccines that are either simulated or so on and so forth. We have those vaccines that are genetically, particles are genetically synthesized and they simulate the organisms and they produce protection. I think we need to begin to introduce the kind of vaccines that may likely come into Nigeria. Is it from the US? Is it from Pfizer? Is it from Moderna? Is it from India? Is it from China? I think that will give a clue to even other interested bodies from the scholars who are interested to deepen research and advise the necessary agencies appropriately. Thank you very much for the opportunity.
Thank you very much. The Deputy President General, Nigeria Supreme Council for Islamic Affairs, Southwest Zone, the Secretary General, Nigeria Supreme Council for Islamic Affairs, and the Executive Director, National Primary Care Development Agency, very distinguished participants, scholars present in this occasion. Once again, I'm Professor Taufik Ibrahim. Most of the key issues have been addressed within the short time that other resource persons have spoken. What are the key issues? I want to be very specific. What are the key issues around COVID and COVID vaccine? Like my immediate predecessor, the person that came to speak before me, the VC, also said, the number one issue to be addressed is that of public trust and confidence. Public trust and confidence. I'm privileged at the time to have worked for the World Health Organization in Nigeria between 2000 and 2004, and I'll tell you the core of the advice that I'm going to give now around COVID vaccine. People, even without Western education, have their native intelligence. At the peak of a scenario in 2004, in a rural community in Sabon Birni, an old man called me to the corner and said, the way we look at you, it looked like we can trust you. Can you tell me, Sakaninka da Allah, if these vaccines you are giving our children are safe? And I will not say more than that. The key issue today, vaccine hesitancy, is not only offering around COVID vaccine in Nigeria, it's global. And I'm happy to note that the current president of the United States, Joe Biden, he has rolled out his national strategy for COVID vaccine campaign, 7 goals strategy, and the first goal is around trust, public trust on the issue of vaccines, and generally with respect to leadership and governance. So the key issue here, vaccines safety and effectiveness. Vaccine safety and effectiveness. And what is the key action that we need to look at? That is the advice for the National Primary Healthcare Development Agency. Before now, we've had a good time, a session to discuss with the Executive Director and some of his team. It should be around the vaccines safety surveillance system. Vaccine safety surveillance system. With this, if we are monitoring, given the need for responsible leadership and governance, if we are able to inform the general public of how we have set up a system that will monitor not only the side effects, but even adverse events. So a system to report vaccines adverse event reporting system has to be put in place. And if we are driving our information to the public based on data-driven evidence, the information that will be going out from every nook and corner, from all segments, should be from experts on the subject. Data-driven, evidence-based, because science and conviction based on truth is never driven by propaganda. It's not about rhetorics. It is you provide the data-driven evidence that will convince the public of your concern for safety and the concern for effectiveness. On this note, I want to thank the organizers. Though the notice was very short, I want to appreciate you to have invited me. When I got that call from Professor Oloyede, all of a sudden, considering how busy he is usually, I knew that it must be a very serious business. So once again, I appreciate the Emir, the Sultan, other Emirs present here, the National Primary Healthcare Development Agency, the Nigeria Supreme Council for Islamic Affairs, for giving me the opportunity to express some of these views here to guide the successful implementation of this program in the country. Assalamu alaikum wa rahmatullahi wa barakatuh.